Uganda, with support from Save the Children Italy, implemented the Ready to Learn project in Karamoja and West Nile regions. The project was built on the successes, lessons learned, and best practices from the EPA-SC project implemented in Nakasongola and Karamoja from 2016 to 2020, and the Centenary project in West Nile to ensure that all children in the targeted districts access quality early childhood care to achieve their full potential in physical, socio-emotional, linguistic, and cognitive development in a safe and conducive environment to ensure that they get a good start in life. The Ready to Learn Project 2023 aims to transition early childhood care development, service delivery, and the management of the ECCD centers to communities with a focus on parents' mobilization and capacity building activities. We spoke to the ECCD learners, ECCD caregivers, parents, program staff, CMCs, and this is what they had to say.
Ready to Learn is a project which is on community sustainability and handover plan. The project aims at ensuring that children 3 to 17 years old, particularly girls, achieve quality basic education. This project is being implemented in Karamoja, that is Moroto and Napak, and it's also being implemented in West Nile region, and that is Arua and Kiriandongo.
It supports learners to develop mentally, spiritually, and physically.
We make sure the learning environment for our children is so conducive. So we make sure we remove all the tree stumps that are around the compound, like closing the holes that are in the playground of our children. We remove broken bottles, stones, and thorns that are around the playground so that our children play when they are not harmed by anything that is so bad.
We conducted trainings, capacity building trainings on center management committees and VSLA members on financial management and resource mobilization. We also went ahead and trained these people on making low-cost learning materials for the learners. Parents are contributing and also collecting these materials to the centers.
We have learned a lot from that training, because the other thing that we are missing in how to create material like local materials, we ensure those things are there in class for children to play with them for easy learning.
So the trainings have really made us be in position to identify some of those children which may be facing some of those emotional concerns from their homes.
They have trained us on issues of child safeguarding and issues of child protection. So here in our communities, people are always used to harass children, perform a lot of things that harm children. But through the trainings that we have got on child protection and child safeguarding, now all our children now are in safe custody of our hands.
We have also gone ahead to encourage the center management committees to be at the center in the decision making of these schools. We encourage them to make independent decisions, and then we are there to support them implementing these decisions.
The CMCs, that is the center management committees, they are the ones managing the center in supervision and buying other missing items, paying the teachers.
We as CMCs, we mobilize parents to bring the children to the school. We do meetings in the school on issues concerning the operation of the school, running of the center.
We shift and we see if we have something, we have to contribute, and we give to the head caregiver to support with. We pick some of money from our pocket and some from the parent.
We also discuss if there are some conflicts between the teachers, and also if parents are not satisfied with what we are doing in the school, then we bring the parents together, we sit together, and we discuss the way forward, how the center have to run.
Through the trainings that we conducted on parents, Parents are contributing in kind and also in cash to support the learning of their children.
We know that Save the Children might not stay in the long run with us. What we do was to mobilize our parents and sensitize the parents that, you know, the school is ours. We need to bring things that need the school to run. One of it is the children have to be in the school. Then secondly, the teachers have to come in. Now, what do we do with these people? These are people also human beings who need eating. We need to look for the resources of what? Making the school to run.
So they make sure every learning day, they mobilize children to school, all the children, even those ones of special needs. Those ones are also brought to school. So the school is so inclusive.
Save the Children decided to help us by preparing us early, making us to form groups. We have some groups like the IGA, Income Generating Activities Groups. They gave us some money where you work, you make a garden, those crops are being grown. Then we brought others to the center, and also we have some seeds. We gave out to some parents that after working from there, you bring something to the center, and the parents are responding.
They support the school in providing food. They dug a garden. They cultivated the maize and beans. So when we harvested that food, it helped us in school.
I want to run the same restaurant to one that will happen. I think I recognize Cotera Catarang to Angular, Mary, Ranka, Rakangade. Apa tu kita go di kira ke ceki yaran yelo sia ketare abu apu kaninga na bota ta ceki atacing dilinga dolia lap imbare ito na kena kita bobo ga na kana la sentalo edi da dang taringa malimo ya da la da tamare ise di ke mam yedi di borengnya ni ajel ne da bunyi ko ri pitong le tamare da wini bore e ye da le munon ni dilinga to gel nere e kidi da la market ya na ikriya rai ke mai te ke si anu ka ta mara ka ra sha bo ngalimo da nye ki akita mangi delu ko tere aru ka polori aguji e buni ai serio ngete dang na bo ko tere rio ngete da ni e buni to riam te ma e na kana kre ngoto ngalu na kana ke si da ni amam bore ata ki da put ke si dang ki delenga to gel ne re bore ni ni ngede bu pa na che rio ngete chana chomba chu rengete bu ke nu che delenga ngule bo ko mu suri da kinata pane da ki muchuru dikina ngi dilinga ngulu en na ngi se apane ta ke madana kina ngi malimo ko epitang la ngo bitor ngi malimo epitang la ta chete apukan kwanta ta chere tana ngulu se to da ngulu se to jal na ngi reng de lu pe lu ake mo ko territory kun to ngi de lo ite.
We do have coordination meetings at districts. Most of the advocacy that we're doing it at district level, where we're calling for their support. We are also conducting a joint monitoring visit to the districts.
We also try as caregivers to lobby from different stakeholders to support the center, like for example the sub-county, and also the health team, the village health team, the VHTs. So they also support us, like when the children fall sick in the center, immediately we ring them and they come and support us, or we even take children to their homes and they treat the children.
Tiya za kwa ketara dang kwesensi itiya wa ketara ni tiya wa ketara bu pa na kalugo bu kemuna ya ba kalulo che pa na ngara kin terang de nyo ye bikul.
One of the key area which I have to thank first Save the Children is they have extended their support to us to fund our VSLS group.
Play and socio-emotional learning has also helped our children, like in socialization. So you'll find that when we bring the idea of socio-emotional learning into our program, into our activities, you will find the children play, socialize, they form friends, and they learn new ideas.
We have seen the physical development is there. Some children were brought when they are weak, even to handle tires was a problem. Some were unable to handle even the pencils. But when we took them through slowly, they have really learned a lot, they have gained.
Are ikena kita kemari kena, kang malimo dang. kina kda mare kina tar ko de lugulu sikulu ke sunu yonga bong ya ne te yo ka ke si nge mutong lu te di ke si madam lo school nge mutong lu mama bo ko ya.
Parents also struggle to dig the school garden and also contribute out of their VSLA. But you will find in this area, the climate always changes. So like in this year, there was totally no harvest. So when there is nothing also now in school like food, what, porridge, even the attendance, you'll find the attendance will drop down.
The caregivers are not enough. So you find you have in a classroom, you have more than 100 children or 120, and you are alone in the class. It's very hard to control the children in class.
I think there's a need of support financial. If you can come and also increase us, give us some support financially to our center will be okay, so that we run our programs very well.
Ibarasa ebe dikesi kirada ni nikang. Raisa epitong lang malimo. Kengara kisi dang malimo wadio ke gangade. Kotere krise kintoteri aketata manyedwe.
We build capacities of the center management committee, the village savings and loan association groups, to be able to manage their finances, because we plan to support them with funds that will support their income generating activities. These income generating activities will empower them financially to be able to support in any running costs of the centers and also to pay the caregiver stipends. We have also gone ahead to disseminate the Ministry of Education ECCD Center Management Manual, which we also went ahead and printed copies for each of the schools. And we believe that this is already something that's tangible that they will be able to refer to whenever they need some guidance on operation running and management of the centers.